Hello, my name is Lori Marion. I am the nurse in the office as well as the IVF coordinator. I like to refer to myself as your tour guide or cruise director through the IVF process. I will be meeting with each of you individually to go over in depth how to use your medications, why you're using your medications, but please refer to these videos for any refreshers you may need along the way. And as always, please feel free to contact myself or Dr. Yasinkaya with any questions throughout the entire process. We are now going to discuss how to mix Menopur. Menopur comes packaged with 5 vials of powder, 5 vials of liquid. Per shot, you need 1 of each, 1 powder, 1 liquid. For mixing purposes, you will need a pink needle and syringe, pink packaged. You will use this to mix the medication. The tops on these vials pop off as such. You will then use your pink needle and syringe to draw out 1 milliliter or cc, those words are interchangeable, of the water solution. To do this, hold the vial upside down, put the needle inside and hold it at eye level as you see here. You will need the 1 milliliter worth of liquid for the injection. There's air pressure in these vials, so make sure that when you're drawing back the solution that you always support the plunger of the needle. If you let go, as you see, the air will pull the liquid back in. So pull to the amount that you need, hold the plunger, take the needle out of the vial, and you can throw the extra water away because you will use a fresh one the next time. Now, you're going to inject the water that you have drawn out into your Menopur powder vial. At this point, the powder becomes liquid almost immediately, but to make sure this happens, you want to swirl the vial a few times. You never want to shake these vials. It can sometimes cause powder to get stuck up around the edges and lose some of the medication, so always swirl. Now, you want to get the liquid back into the syringe you just mixed. So again, hold the vial upside down at eye level, put the needle into the vial, and slowly pull back, making sure the needle always remains in the water. Don't let it get up in the air at the top or you will draw back air. When you think you have gotten everything out, turn the vial over, double check that there's no liquid left in the vial. You're going to have some extra air in the syringe. You're going to want to push that out. Recap this needle, and we're going to take it off. We don't want to give ourselves a shot with this large needle. Then you're going to switch to, you'll have a brown little small 30 gauge needle in your supplies that were sent to you. That will screw on. At this point, you're ready for your injection. The shot's going to go as described here on this diagram. You're going to use, usually you will use the lower part of your abdomen. If you draw an imaginary line across your belly button in the lower part of the stomach, you will pinch up the skin where you're wanting to do the injection with your non-dominant hand. Inject the tip of the needle in, and you will go the full length of the needle. This is a small needle. Inject all of the medication, draw out, and then you can dispose of this needle in the sharps container that was supplied to you along with your supplies.